Hello, my name is Daniela Leon-Garcia. That's Daniella. Last name Leon-Garcia. Student number is 146632237. Today I'll be completing the neuro and respiratory assessment. I'll just do a 360 scan of my room. Okay, and I will call in my patient. Mr. John Smith?
Oh, yes.
Hi, John. How are you doing today?
I am okay.
That's great. My name is Daniela. I'm going to be your nurse for this afternoon. I'm just going to take some vital signs for you.
Okay.
And do a quick assessment. We'll check your temperature. Temperature is 39.7. Blood pressure is 115/70.
Sorry.
Your heart rate is 115 and your respiratory rate is 22. His blood pressure is normal. His respiratory rate is just outside the normal limits for an adult. He is tachycardic and he is febrile, which could have something to do with each other. I'll move on to my symptom analysis. John, can you tell me when your headache started?
It started about a day ago, but it was much worse today.
Okay, and is there anything that happened that made it worse?
No, just moving around and light's been really bugging me.
Is there anything that's made it better?
Not really. Just pretty much when I fall asleep and I've been taking a lot of naps.
Okay, and what's the quality of pain like? Is it throbbing, dull, sharp?
It's throbbing.
Okay, and does it hurt anywhere in particular?
It's everywhere.
Everywhere. And is it radiating anywhere, the pain?
My neck has felt a little bit stiff today.
Okay, and does it hurt when you do anything specific? Can you move your head up and down for me?
Like nodding yes and no kind of hurts and like looking side to side. But I can go this way and it doesn't feel too bad.
Okay. And how bad is the pain on a scale of 1 to 10?
I'm taking 8 right now.
That's pretty high. Is there anything that you've done to help with the pain to make it feel better?
I tried taking Tylenol and Advil, but it didn't seem to help too much.
Okay, and is the headache lasting you all day long?
Yes.
Not worse in the morning, not worse at night?
No.
Okay. And is there anything that happened to your understanding that brought the headache on?
Not that I know of. It just kind of came out of nowhere.
Okay. Any head injury that occurred in the past couple of days? Did you bump your head in the accident?
No.
No? You said you had some dizziness. Does it feel like you're spinning or like the room is spinning?
It's kind of like the room is spinning.
Okay. You said it made you feel nauseous. Any vomiting?
No.
No. Okay. Any weakness in your arms and legs?
No.
No. And any difficulty with speech?
No.
No. Any difficulty swallowing?
No.
Okay. And how about difficulty walking?
No.
How about with fine movements, like writing?
No.
No, that's great. And has anybody in your family ever experienced headaches or migraines before?
No.
And nothing like this has ever happened to you before?
No, never.
All right. And I hear you coughing a little bit. Is that a new cough?
Yeah, it started with the headache.
Okay. And any thing coming up with your cough?
No, not really.
Okay. Do you find that you have any difficulty breathing, shortness of breath?
No, not
Any
really.
pain in your chest?
A little bit when I breathe, but I think it's from all the coughing.
Okay. How bad is that pain on a scale of 1 to 10?
Maybe like a 4.
All right. And does it radiate anywhere? To your back, down your ribs?
No.
No. Okay. And is it worse at any certain time of the day?
No, it's all the time.
It's all the time. And have you taken anything to help with that?
No.
Okay. On inspection, the patient has a normal appearance. He's got no abnormal behavior. He's alert and oriented to person, time, and place. He has no difficulty with gait or coordination as when he walked into the room. He's got no signs of respiratory distress. He has no signs of cyanosis in the lips or in the extremities. No increased work of breathing. His respiratory rate is unlabored and easy. And he's not using any accessory muscles. So continuing on with my assessment, he is a GCS of 15. His eyes are open spontaneously. His peripheral responses are oriented, and he's following commands. John, I'm just going to have a look into your eyes, if you don't mind. Just stare forward for me. I'm going to shine the light, okay? Okay, and the other His pupils are equal, round, reactive to light, and accommodation. I'm just going to test your arms and legs, John. If you can squeeze my fingers with both hands, that's great. And if you can hold your arms out for me, I'd like you just to push against my hands. That's great. And I'm going to push in, you push out. Wonderful. And now your legs. If you can press down on my hands like a gas pedal. Both sides. That's great. Okay. That's perfect. And I'm just going to have a listen to your chest, if that's all right. I'm going to take some normal breaths from me, and if you need to cough, you can. Okay, I'm just going to listen to the back. Okay, John, thank you very much. I'm just going to get in touch with the doctor, and we'll see if we can get you something for your headache, okay? I'm just going to get in touch with our physician. Hi, Dr. Michaels. This is Daniela. I'm taking care of John. He is a 17-year-old male who came in with a chief complaint of worsening headache, dizziness, weakness, and a fever. He does have a history of type 1 diabetes, which has been poorly controlled. He's in and out of hospital for this. And he's attending high school right now in a low-income area. He, on assessment, has a temperature of 39.7. His blood pressure is 115/70. His heart rate is 115, and his respiratory rate is 22. He's complaining 8 out of 10 headache. That's not improved with Tylenol or Advil. He's also complaining of some neck pain with flexion and extension. And he does have a new onset of a cough for the last couple of days. It's non-productive, with a little bit of chest pain on inspiration. He is not complaining of much pain in his chest. It's a 4 out of 10. My recommendation would be to collect some blood cultures, respiratory cultures, and urine cultures for him, and perhaps a chest x-ray just to see what's going on in his chest. He's also complaining of some nausea, so perhaps some IV fluid and antiemetic would help him, along with antipyretic for his temperature. Thank you very much. In terms of critical thinking, based on his clinical manifestations, John is experiencing headache, neck pain, along with fever and some respiratory symptoms. In terms of differential diagnosis, my mind goes to meningitis. Some orders that I would expect to see would be collection of pan cultures for the patient to determine source of infection, along with IV fluids and an antipyretic. Some nursing interventions that I would implement would be to dim the lights in the room to provide John with a dark environment, and some cooling therapy to help bring down his temperature